tell me about your experience in working in education? Were you a teacher?
So after college, I taught for a couple of years in private schools,
Yeah.
because partly because like both of my parents worked in public schools and were like, if you want to like try teaching, like go to a private school. And
Yeah.
also because you don't need a master's to teach in a private school the way you do in a public school.
So you did that right out of Trinity.
Right out of Trinity, yeah.
Yep.
I taught at an all-girls boarding school in Virginia for 2 years, which was super interesting. And then
Where
I
in
went back,
Virginia was it?
Middleburg was
Okay.
Foxcroft, which
I
just
don't know.
sounds like like you kind of know everything you need to know about the school from the name.
Okay.
Um, and then I went back to Boston and spent another year teaching in a private school there. And then I was like, teaching in private school is not what I want to do forever. So I did AmeriCorps for a year. I worked in a program that worked with kids who had left, I don't know, kids who had dropped out of high school, although now I'm learning about saying push out instead of drop out. So I worked there for a year and then I went back to school for counseling. At BU, and after I finished that, I did school-based counseling in Boston Public Schools for like 5 years.
Yeah.
And that was kind of crazy because so you're doing mental health counseling, which is like healthcare. So there's this sort of a bunch of nonprofits in Boston, and I think kind of spreading elsewhere, but I know like a few do it in Boston, would kind of contract with the schools to send counselors in to do mental health counseling, but we would be billing health insurance. So there's like pros and cons. We would be kind of like
Hold
capturing,
up.
yeah.
No, no, the only reason I'm telling you to hold up is because I actually work in healthcare right now, in administration side. So I deal with insurance and stuff. And I
Yeah.
wasn't quite sure how mental health care providers, and I wasn't aware until you mentioned right now the pay structure for you.
Yeah.
For those healthcare providers in schools. Are you telling me that as a mental health care provider to children, you would go into Boston public schools, you would speak to the children, give them mental health counseling, and then you'd be billing private insurance?
Yes. Most of the
Wow.
kids that we saw had like the state sponsor, like state insurance.
Sure,
Um,
sure. But
but
I just,
but yeah, but I had like a caseload of clients who
yeah.
happened to be at like the 2 or 3 schools that I was stationed at. So the nonprofit doesn't have to pay for office space. The school doesn't have to pay for mental health care. And we like kind of captured this population of kids whose parents wouldn't necessarily be able to get them into like an office after school, like once a week.
Hold
Um,
on. Wait, you said the nonprofit, the organization that you worked for was a nonprofit?
yeah, and there's
Okay.
nonprofit and for-profit places that do this.
Okay. Interesting. All right. So that's a whole other like dimension
Yeah,
in
so
it too.
like they handle the billing basically and like supervision and like that
I
stuff.
just like why like I look at it just from you explaining it. Why does it have to be um delegated to the nonprofit industry? You know, like why like I want kids in this like in the schools right now, and I don't have children right now, but like I want kids in public schools to have access to mental health counseling. Like this is ridiculous that like it's not provided by us taxpayers. You know, I
Yeah,
feel like it enhances society when a child learns how to express their emotional traumas and things going on with them mentally. That helps society. They grow up to become more productive adults. If you want to talk about it from a fiscal stance, they're more productive as a result. Like
Yeah.
you get a return on your investment by paying for these services. I just think it's a shame. And it's the work that you're doing like is fantastic. But in terms of the structure and realizing this is not done by us, the state is not allocating funds for that, and it's sad. I don't know
Yeah.
what else to say.
No, I'm 100% on board with everything that you said. And it was, I mean, it was kind of crazy. It was like the schools just don't have the resources to provide this. But then like health insurance doesn't really want to be paying for like school services. So there was like, when we build, like if you, I mean, and this is all like part of why I left, which like, I don't know, which I feel like angry and guilty about, but like it was an unsustainable system in a lot of ways. And part of why I left was I felt like I was like contributing to this like totally broken system, as much as I like loved working with the kids that I worked with, or like these two totally broken systems, which were like public education and like the healthcare industry in America. And
So, friends, thanks for tuning in to another clip of Johnny's Jabs. If you liked what you just saw, please be sure to share this with your family and friends and comment below. And if you want to get more content like this, it's easy. Just click the bell below to subscribe. Follow me on Instagram and Twitter at Johnny Jabor. I'll catch you guys next time.